Hello, my name is Shelley Allison, and I'm a nurse practitioner student with Southeastern Louisiana University. I'm here today with my patient, Mr. Jones, who is inquiring about his colorectal cancer screening. Mr. Jones, I have developed this PowerPoint presentation for you to go over your options and screening test. You have specifically displayed interest in knowing more about colonoscopy versus stool-based DNA testing, otherwise known as Cologuard. So let's get started. We have already assessed Mr. Jones's pre-test knowledge by asking him some questions that we will ask after this is complete. So, colorectal cancer, what is it? Colorectal cancer is an abnormal growth of cells on the wall of your colon or your rectum. And it is the second leading cause of cancer-related deaths worldwide. It is also the fourth leading cause of all related deaths worldwide. When should you get screened? You should start beginning screening according to the United States Preventative Services Task Force at age 50. Currently, more research is being done in this area as we are seeing younger and younger patients being diagnosed with colorectal cancer. Who is at risk for colon cancer? Everybody is at risk, regardless of their age, ethnicity, or lifestyle. And everybody should have a screening test done. And that is why good news is colorectal cancer is preventable through screening tests. Now, you have specifically displayed your interest in learning more about colonoscopy and stool-based DNA testing, which we have known as Cologuard. So colonoscopy is a minimally invasive procedure you will have to complete a bowel prep for, and a gastroenterologist will complete this procedure. The stool-based DNA testing, or Cologuard, is completed at your home. So let's talk about some of the pros and cons of colonoscopies and some of the pros and cons of the stool-based testing, or Cologuard. Some of our pros for colonoscopy include that it is the most accurate test for detecting colorectal cancer. Your doctor can remove precancerous lesions, which could become cancer, while he's doing your colonoscopy. If your results are negative, you won't have to have another screening test for 10 years. Some of the cons include the small risks that are associated with colonoscopy, which in the most common risks are bleeding and perforation. But again, these are very minimal risk. You will have to complete a bowel preparation, and you may experience some bloating and cramping after the procedure. Some of the pros for stool-based DNA testing, or Cologuard, include that it's non-invasive. You can complete this test in your home, and you will have no pain or discomfort, and does not require a bowel preparation. Some of the cons of the Cologuard test include that it does not detect colorectal cancer 100% of the time. In fact, Exact Sciences, who's the manufacturer of Cologuard, reports on their website that 8% of colorectal cancers are missed. If the test is positive, you will have to ultimately undergo a colonoscopy. If you use this test as your screening benefit, your insurance provider may not pay for you to have that subsequent colonoscopy done. So those are some considerations that you might want to think about. I have provided you some handouts on what we just discussed. The pros and cons of colonoscopy, the pros and cons of Cologuard, and also just generally frequently asked questions about colorectal cancer screening. Now let's test your knowledge. Mr. Jones, true or false questions. True or false? Colorectal cancer is the second leading cause of cancer-related deaths worldwide. Correct, this is true. If detected early, colorectal cancer has a 90% survival rate. Correct, this is true. I can start my colorectal cancer screening at age 60. That is false. You, Mr. Jones, are age 52, and you should have begun your screening at age 50, like we discussed. I could not develop colorectal cancer because no one in my family had it. That is false. Anybody is at risk for colorectal cancer regardless of family history. The most accurate test for colorectal cancer is a screening colonoscopy. That is true, correct. Stool-based DNA testing, or Cologuard, detects colorectal cancers 100% of the time. That is false. In fact, remember we discussed that it's an 8% chance that it can miss a colorectal cancer. If my Cologuard is positive, I will not need further testing. Correct, that is false. That is false because you will, in fact, have to undergo a colonoscopy if your Cologuard test is positive. The most common risks associated with colonoscopies are perforation and bleeding. True, yes, absolutely. Those are the two most common risks, but again, those are very low risk. All right, Mr. Jones, do you have any questions that I can answer for you today? No. Okay. All right. Well, thank you. And we'll discuss further whether or not you're going to decide a colonoscopy or a screening with the Cologuard.